where most people didn't know what public health was, now they do. We have underinvested in public health for so long. And I do believe that we are collectively learning that in order for us to really have health, we have to have public health.
So Marianne was the one who set all of this in motion back in 2007.
I would describe Marianne as vibrant. She's full of life, passion, and commitment.
Strong. The one that comes top of mind is driven.
Passionate.
My word for Marianne is a combination of passion and compassion.
A public service force of nature.
Extremely knowledgeable.
My word is preeminence. Marianne is the best at what she does.
One word to describe Marianne is inspirational.
I'm going to say peacemaker. She really excels at finding common ground and bringing people back to our shared values.
Persistent.
Unrelentless. There is not an obstacle that she won't overcome.
Deeply insightful. She just has a unique way of seeing beyond the words.
Marianne is a mentor. That's something that I know I'm very grateful for.
Marianne is always prepared.
Trailblazer. Without her, I think there'd be far fewer women in healthcare and in healthcare leadership roles.
Determined. Marianne cares deeply about people and about delivering quality healthcare to every American, and knows what a fight that is and doesn't give up.
The issues in health and public health are not simple. They are human problems, right? And they are not simple or one-dimensional problems. They are problems that require complex thinking, a depth of understanding about human nature, as well as technical knowledge in the field. When we launched, people did not know how many people were uninsured in Michigan. When we launched, people didn't actually even know how much we were spending on healthcare and for what. The data was sort of out there, but it was really hard to get a handle on, and our policymakers at the state level and our health system leaders just didn't have access to this information. And that's where we began. We began by providing information to help policymakers make more informed, evidence-based decisions.
Marianne sort of had the seed of the idea that doing a survey would be, a really good addition to the work we were doing at CHRT to help inform policymakers.
The WHO was instrumental in ensuring that the ACA enrollment process would be successful. It was always about that core vision, which was, how do we improve healthcare for vulnerable populations in Washtenaw County?
Researchers really want policymakers to use their work when they make decisions about important health policy issues. And so we created the fellowship as an opportunity for health services researchers and policymakers to come together and learn from each other.
My experience with the CHRT Fellowship was totally profound.
When I was in my policy fellowship, Medicaid work requirements were being considered in Michigan, and I wrote an op-ed with Marianne and Luke Schaefer talking about the implications.
Through Marianne and the fellowship, I learned how to take research and package it in a way that it was relevant outside of our academic journals and in the real world for real world impact.
CHRT was instrumental in Michigan making a decision to expand Medicaid. The governor at that time, Governor Snyder, relied on the research and information from CHRT to help him decide whether or not to support Medicaid expansion.
CHRT played a very crucial role in assessing the primary care workforce and health system capacity. Did we have the ability to provide services to hundreds of thousands of residents who would be newly covered by Medicaid expansion? And CHRT surveys found that there was that capacity, and that was influential in the governor's and legislature's decision to expand Medicaid as part of the Affordable Care Act.
My Community Care is a community-wide consortium where we were able to build care management into the community as a community-wide function, rather than independent care managers coming from a whole lot of different places. And for the patients that we care about most, who used different parts of the system. It provided an interstitium to connect care management across organizations in ways that weren't previously possible.
For the past several years, CHRT has been working with the Kresge Foundation to develop and implement a grant program around health and human services integration to promote equitable and thriving communities across the United States.
The Vital Seniors Initiative aims to connect the most vulnerable older adults to critical services.
My word for CHRT's COVID response is efficacy. They married their deep competence with the ability to get answers quickly and to do work and to work with the state government and other entities to really get the answers that decision makers needed extremely fast.
Well, I think that Teresa is a tremendous talent and that she has an insightful nature, a curiosity about her that engages others.
CHRT is very well positioned to handle issues related to pandemic response, the rising recommitment to race and health equity in the marketplace, and also addressing the underlying reasons and root causes of why there's been a lack of public trust in our public health institutions.
I think that that engagement will help to elevate CHRT, and it's going to carry on a legacy that Marianne has left behind.